Hi, I'm Dr. Rick Duplantis, and welcome to It's Your Health, the program designed to empower you with knowledge and information to make healthy decisions in your life. Our topic tonight is on Bell's palsy. It's a facial paralysis that affects men and women equally. It's a very disfiguring condition. It's thought to be caused by the virus that causes fever blisters, herpes simplex. Have in front of us on this slide, our first slide tonight, this is a picture of someone with Bell's palsy. It's causing a paralysis of the face. You see a drooping in the right side of the smile. You see the right eye is open much wider than the left eye. And there's a drooping. And also you're looking at the brow as well, and you can tell it's also paralyzed on the right side. You know, as a distinguishing factor, it's a clinical call, Bell's palsy is, by a neurologist or an internist with the knowledge for this condition to examine it and to make that diagnosis. But what distinguishes Bell's palsy from actual stroke would be inability to move the brow by wrinkling the brow and raising the eyelids, or the eyebrows more or less. And that inability to do that on that one affected side is a sign of Bell's palsy. And this doesn't happen in someone with a stroke. You know, that's left intact. So, but Bell's palsy is a form of temporary facial paralysis. Like I said, it results from damage or trauma to the facial nerve, the seventh cranial nerve. And I'll show here, this is a very good anatomical diagram showing the facial nerve. It comes out right in front of the ear, and it goes to the branches that go to the eye. It supplies the muscles of facial expression, and that's why when someone smiles with Bell's palsy, one side of the smile, there's a drooping on one side of the face. There's an ipsilateral paralysis on the side of the affected nerve. Like it's thought to be caused by the herpes simplex virus that gets into the nerve root itself of the facial nerve, and the nerve begins to swell. And it's in a canal called the fallopian canal, a bony canal that it travels in, and it makes its exit in front of the ear. And in that bony canal, it starts to swell where this virus has infected it and causes the destruction of the nerve. Everything distal to that nerve begins to die. And the nerve loses its function from that standpoint. The treatment for it is there are various treatments. But, you know, we call it the seventh cranial nerve. It's coming through this fallopian canal in the skull. It's right beneath the ear. It supplies the muscles on each side of the face. And for most of its journey, the nerve is encased in this bony shell. And then, like I said, when it swells, it causes a problem. Each facial nerve directs the muscles on one side of the face, including those that control eye blinking, eye closing, facial expressions, such as smiling and frowning. These are all affected in Bell's palsy. As you can see from this picture, the diagram shown on it, I think this is an excellent slide that depicts it, shows the nerve and also shows the down turn of the right lip on the side of the subject involved. You know, when Bell's palsy occurs, the function of the facial nerve is disrupted, and it causes an interruption in the message the brain sends to the facial muscles. Here again, another excellent picture showing the actual disfiguration of the facial muscles, the muscles of facial expression here. Bell's palsy is named for Sir Charles Bell, a 19th century Scottish surgeon who was the first to describe the condition. This disorder, which is not related to stroke, is the most common cause of facial paralysis. Now, generally, Bell's palsy affects only one of the paired facial nerves and one side of the face only. However, in rare cases, it can affect both sides. What are the symptoms? Because the facial nerve has so many functions and is so complex, damage to the nerve or disruption of its function can lead to many problems. The symptoms of Bell's palsy can vary from person to person and range from severity, from mild weakness to total paralysis. These symptoms may include twitching, a weakness or paralysis on one or rarely both sides of the face. Other symptoms may include drooping of the eyelid, drooping of the corner of the mouth on the affected side, drooling, dryness of the eye or mouth, impairment of taste, and excessive tearing in one eye. Most often these symptoms, which usually begin suddenly and reach their peak within 48 hours, lead to a significant facial distortion, as you can see on this diagram. You have other symptoms, such as in pain. You get headaches, severe headaches from this. You get discomfort around the jaw, behind the ear, there's pain. It's ringing in one or both ears as a result. The loss of taste. You get hypersensitivity to sound. Regular sounds or even conversation sound twice as loud to someone with Bell's palsy, called hyperacusis. They get impaired speech at sometimes, dizziness, difficulty eating and drinking as well. It's a very debilitating and very sad condition. Bell's palsy occurs when the nerve that controls the facial muscle is swollen, inflamed, and becomes compressed. This results in the facial weakness or paralysis. Exactly what causes damage is unknown. There are many scientists and physicians believe that there's a viral infections, such as the viral meningitis or the common cold sore, herpes simplex, can cause Bell's palsy or cause this disorder. They believe that the facial nerve swells and becomes inflamed in reaction to the infection. This causes pressure within this canal, this bony fallopian canal, leading to ischemia, restricted blood supply to the rest of the nerve, to the distal aspects of the nerve. Everything proximal still intact, proximal to that inflammatory section of the nerve. In some mild cases where recovery is rapid, there's damage only to the myelin sheath of the nerve. The myelin sheath is that fatty covering which acts as an insulator or nerve fibers in the brain. This disorder has also been associated with influenza and flu-like illness. It's been associated with headaches, chronic middle ear infections, high blood pressure, diabetes, sarcoidosis, tumors, Lyme disease, trauma, and skull fractures or facial injury. Who gets Bell's palsy? Well, Bell's palsy affects approximately 40,000 Americans each year. It affects men and women equally, as I said, and can occur at any age, but it is less common before the age of 15 or after the age of 60 for some reason. It disproportionately attacks people who have diabetes or upper respiratory ailments such as the flu or a cold. How is Bell's palsy diagnosed? Well, a diagnosis of Bell's palsy is made on a clinical presentation, excluding distorted facial appearance, as we see in this facial slide here. It shows the Bell's palsy on the right in this individual, or your left. Also shows the nerves involved. The facial nerves are diagrammed in the opposite anatomical model. By ruling out other possible causes of facial paralysis, there's no specific test, lab test you can do to diagnose Bell's palsy. Generally, a physician will examine the individual for upper and lower facial weakness. The most cases of weakness is limited to one side of the face, occasionally isolated to the forehead, eyelid, or mouth. A test called the EMG, electromyography, can confirm the presence of nerve damage and determine the severity and extent of nerve involvement. Blood tests can sometimes be helpful in diagnosis of other concurrent problems such as diabetes or certain infections. MRI can also be used to eliminate and to rule out other conditions such as multiple sclerosis. A CT scan can eliminate other structural causes for pressure on the facial nerves. How is it treated? Bell's palsy affects each individual very differently. In some cases are very mild and they clear up and they require treatment as symptoms usually subside on their own in about 2 weeks. And they get complete restoration of their facial muscles of facial expression, and it does not leave any traces. For others, treatment may include medications such as therapeutic options of, they use prednisone. Research studies have shown that steroids, such as the steroid prednisone, is used to reduce its inflammation and swelling, or effective in treating Bell's palsy, bring down this swelling and allow the nerve to regenerate, the blood supply to be restored to the nerve. Other drugs, such as acyclovir, which are used to treat herpes simplex viruses, are used to fight the viral herpes infections thought to cause it. It may also have some benefits in shortening the course of the disease. Here is an excellent diagram of the facial nerve as it supplies the eye and goes to the lips and to the muscles of facial expression. Another important factor in the treatment is eye protection. You know, Bell's palsy can interrupt the eyelid's natural blinking ability. It leaves the eye exposed to drying out and irritation. Therefore, keeping the eye moist with artificial tears and from debris and injury, especially at night, is important. Sometimes you have to actually tape the eyelid and tape the eye closed. Lubricating eye drops, such as artificial tears, as I said, eye ointment at night to place into the eye and then tape them closed, or gels and eye patches are very effective and are used in treating Bell's palsy. These side effects that affect the eye. Physical therapy to stimulate the facial nerve and help maintain muscle tone may be beneficial, but very little for restoring the muscles of facial expression. Facial massage and exercise may help prevent some permanent contractures or shrinking of some of the muscles when they become weakened or paralyzed before recovery takes place. Moist heat applied to the affected side of the face may help to reduce the pain as well. You know, other therapies that may be useful for some individuals include relaxation techniques, acupuncture, electrical stimulation, biofeedback training for stress. You know, some vitamin therapy such as B12, B6, and zinc may help restore nerve function. You know, in general, there's a very, very complex surgery called the decompression procedure for Bell's palsy. It's a very, very serious operation, 8 hours in duration, to relieve and decompress this nerve in this fallopian canal. And they actually bore this canal out. It's an 8-hour procedure, very, very intricate, tracing the facial nerve from the base of the brain all the way out to where it goes, exits from the ear. And going throughout this entire canal, widening the canal, this is the treatment of decompression for the facial nerve. And those individuals who do not get relief from prednisone and still have facial damage, and for some people it's done due to pain. It's intractable headaches with Bell's palsy. Rare occasions, cosmetic or reconstructive surgery may be needed to reduce some of these aftermath deformities and correct some of the damage, such as an eyelid that did not fully close or a crooked smile, for instance. What is the prognosis? You know, the prognosis for individuals with Bell's palsy is generally very good for most. The extent of nerve damage determines the extent of recovery. Improvement is gradually, and recovery times will vary in this condition. You know, with or without treatment, most individuals begin to get better within 2 weeks after the initial onset of symptoms. Most recover completely and return to normal function within 3 to 6 months. It takes time. It's a very slow process of these nerves regenerating back to full function. And when they do, they can get crisscrossed backwards. Someone who sits down to eat, it can cause them to tear. Some symptoms may last longer than 3 months. In few cases, the symptoms may never completely disappear. In rare cases, this disorder may recur either on the same side, on the opposite side of the face, continuously. You know, it's called idiopathic facial paralysis. It's the most common cause of uterine facial paralysis, and it's the most common cause of paralysis of the face worldwide, actually. It's one of the most common neurological disorders of the cranial nerves. It is a great majority of cases, Bell's palsy resolves over time. And its cause, like I said, is unknown. Here we have a slide of the damage done, the turned down smile, the left eye, the eyelid not closing completely. You know, it clearly shows one eyebrow a little bit higher than the other. It shows the brow not able to wrinkle over the affected side on the Bell's palsy side of this person in the slide. You know, recommendations: patients with acute onset of unilateral facial paralysis should be assessed to exclude other possibilities such as Lyme disease, sarcoidosis, stroke as well. Diagnostic imaging and routine lab testing is not recommended. You know, if there's an impaired eye closure, appropriate eye protection is always implemented. And this shows a natural face, a natural facial expression, and it shows the person on your left with Bell's palsy, and shows the difference in normal to the abnormal effect, how it affects the muscles of facial expression. Now you notice that the eye, the right eye in the person on the left is open much wider. The eyelid not working properly, not closing. And you notice there's a difference in the lips, the downturned smile, and the model on the left. The signs and symptoms of Bell's palsy would be posterior auricular pain, pain behind the ear. Onset is usually one-sided. It's either upper or lower facial paralysis over a 48-hour period. You have decreased hearing. You have hyperacusis. Sound becomes much louder. It hurts your ears. You have taste disturbances. You have weakness of the facial muscles. You see poor eyelid closure, aching of the ear, or a pain behind the ear on the affected side. Sometimes you'll get some tingling numbness in the cheeks or mouth. You get euphoria. You can get pain in the eye, ocular pain. Blurred vision can occur. Flattening of the forehead or nasolabial fold on the side affected by the palsy. When the patient raises their eyebrow, the paralysis side affected of the forehead remains flat. When the patient smiles, the face becomes distorted and it lateralizes to one opposite side of the palsy. The clinical presentation, more specific information. Well, diagnosis, examination, it's a clinical call, as I had mentioned. You have a grade 1, which is normal function, a grade 2, Bell's palsy, mild dysfunction. You have a grade 3, moderate dysfunction, and a grade 4, moderately severe, grade 5, severe dysfunction, a grade 6, total paralysis. And I have seen individuals with total paralysis. And it is not, and this is here, this slide depicts a total paralysis. You see the eye partially open. You see the downturned lip on the affected side. On this individual, it's on your right side, or his left. And you see how it disfigures the face. This is a very good representation of the Bell's palsy person. Treatment, like I said, they use a prednisone. There is a mini test that they do. They do erythrocyte sedimentation rate, they do thyroid function, they do a glucose for diabetes, they can do cerebrospinal fluid analysis, blood glucose, they do a hemoglobin A1C to see if they're diabetic. They do an anti-neutrophil cytoplasmic antibody level, a salivary flow, a scrimmage blotting test, nerve excitability, and the CT MRI, as we mentioned. Management, to improve the function, it's strictly the prednisone and acyclovir. This is a very good demonstration of the nerve. It shows the myelin sheath, it shows the axon, as it shows it branching out into the dendrites, and it shows the area of where the damage takes place in the myelin sheath. Everything distal loses blood supply and atrophies and causes dysfunction in the nerve. Everything proximal to the nerve, to the swelling or the involved site, remains intact with complete blood supply. This is a very debilitating problem. Facial nerve grafting has been implemented, but not very many people have a transplant of the facial nerve from the unaffected side to the affected side. Bell's palsy is more appropriately termed idiopathic facial paralysis. It's the most common cause of facial paralysis. In 80% of the cases, they resolve over time. There's a controversy around the treatment. Like I said, they're treating herpes simplex virus, but they really don't know if that's the cause, so they are trying to cover that issue. But it's just a guessing game. It's one of the most common neurological disorders affecting the cranial nerves. It's the most common cause of facial paralysis worldwide, thought to account for 75% of cases in acute one-sided facial paralysis. It's more common in adults, in people with diabetes, in pregnant women. And this is an interesting fact, that Bell's palsy is more common in adults, it's more common in people with diabetes, and in pregnant women. Like I said, determining the diagnosis for facial nerve paralysis is peripheral or central. It's key to step in the diagnosis. and a lesion involving the central motor nerves above the level of the facial nucleus in the pons causes weakness of the lower face only. Thorough history taking and examination, including the ears, the nose, throat, and cranial nerves, must be performed. The minimum diagnostic criteria include paralysis of all muscle groups on one side of the face. Secondly, sudden onset of this, and then an absence of the central nervous system disease. Note that the diagnosis of ipsilateral facial paralysis can be made only after other causes of acute paralysis have been excluded. And the clinical findings are doubtful, or if the paralysis lasts longer than 6 to 8 weeks, further investigation is warranted, including many other studies such as MRI, temporal bone and pons should be considered, electrodiagnostic tests, Stapedi's reflex test, evoked nerve electromyography, and audiography may help to improve the accuracy or prognosis in difficult cases. Treatment is guided by the severity and probability of prognosis in each particular case. Studies have shown benefit in high-dose corticosteroids such as prednisone. Although antiviral treatment is used, evidence is very limited on how effective it is in terminating the duration of the actual case. Ocular therapy is used in most cases topically to maintain the eyes and to protect the eyes from drying out and from irritation. Patient education: to prevent corneal abrasions, patients should be instructed about eye care with Bell's palsy. They should be encouraged to do facial muscle exercises using passive range of motion, as well as actively closing their eyelids and smile. For patient education information, there's a great deal of information that you can find, I'm sure, on the internet on this topic. The precise pathophysiology of Bell's palsy is a very big area of debate. The facial nerve courses through the temporal bone, referred as the facial canal, the swelling inside this canal, the destruction of the nerve as it swells, distal to the site of swelling and inflammation, causes all the destruction that we see exhibited in this facial muscle paralysis. This is a very debilitating condition, friends, and Bell's palsy causes not only facial disfigurement, but it can cause psychological issues. It can cause depression. Imagine trying to deal with this disfiguration that comes on and happens, and it happens suddenly, and you go out in public and you're trying to move about and you have this Bell's palsy condition. People look at you like, there's something wrong with you. Well, you have Bell's palsy. And it's like a stigma. It brings attention to you. And, if you know anyone with this type of condition or one of your loved ones, maybe you have now a better understanding of this condition. I hope this has given you some insight to this rare condition, but you do see it. We do see it in our family members. We do see it in our friends. When you see someone with this type of condition, now you might be able to recognize and understand what this person has gone through. I'm Dr. Rick Duplantis. I hope you've gained insight, greater information into this condition called Bell's palsy. If you ever develop these signs or symptoms, please don't hesitate to see a neurologist at once and get attention, start medication, and start being treated immediately for this condition. You must rule out other conditions that could potentially be the cause of facial paralysis. A neurologist should be sought if this occurs. I'm Dr. Rick Duplantis, wishing you a very pleasant evening. God bless. Thank you for viewing.